It's time for this week's First Utah Business Spotlight.
Mark Hunter here with Small to Large on K-Talk Radio, and today we're here with Dr. Goff with the Rocky Mountain Retina Consultants, correct?
That's correct.
Okay, great. So Dr. Goff, tell us what RMRC does. What do you do for your patients?
Sure. So Rocky Mountain Retina Consultants is a group of 3 retina specialists, and we serve 4 states with 6 clinics. We have offices here in Utah, we have offices in Nevada, and Montana and Wyoming.
Wow.
So we're very geographically spread, and we provide comprehensive retina service to our patients.
But you're corporately headquartered here in Utah?
Right, our main office is here in Salt Lake City.
Okay. And we're off of, what, 7th East and about 45th South?
Yep, that's correct.
Okay.
The services we offer, again, are comprehensive care, medical and surgical, for the posterior part of the eye, for the retina and the anything in the back part of your eye.
Okay.
We also have a diagnostic testing center that we can talk about that we offer to other doctors in the community, where we will perform diagnostic testing and interpret those tests. And then we have a very active clinical research program where we enroll patients in clinical trials.
Let's talk about that. Tell us about the clinical trials. What are those for?
Well, clinical trials are generally to examine new drugs and technologies and see if they are safe and effective for patients. Mm-hmm. There are many diseases in the field of retina that there is an unmet need to take care of these diseases, and we're trying to discover if these newer medicines are helpful. So, for example, right now we're involved in numerous trials, mostly for diabetic disease in the back of the eye and for age-related macular degeneration. There are a couple of forms of age-related macular degeneration, a dry form and a wet form. The wet form has some very effective treatments now, and we are in some clinical trials looking at newer ones. But the dry form, you may be aware, there really isn't any effective treatment for that to date, and we're involved in a clinical trial looking at drugs that hopefully someday will provide a new, novel treatment for dry macular degeneration.
Well, that's great. So what is the result of that for people who are listening and watching this? What if I had that disease? What could I expect?
Are you macular degeneration?
Yes.
Well, macular degeneration is a disease where you accumulate waste material in the back of your eye. The back of your eye is lined with the retina, which is kind of like the film in a camera. Mm-hmm. And the center of your retina is the macula. And if you accumulate these waste materials back there, it can interfere with your vision. And sometimes these waste materials can lead to bleeding, and that's the wet form of the disease.
Oh, okay.
If patients who get this, they get blurry vision right in the center. And if they get the wet form, that's even worse. The wet form causes very severe vision loss, often abrupt onset, and it can be really frightening and debilitating.
Is that just bleeding in the eye? Is that where it's taking place? So it's not necessarily visual on the outside of the...
Right, it's not visible on the outside. It's deep in there. It's in the retina.
Okay.
So you wouldn't see anything looking at the patient, but when they're looking out, the center of their vision can be very, very blurry. And again, it can be severe with the wet form, disabling and frightening. So that's what people would experience. If they just have the dry form, then they may just have mild symptoms, a little bit of blurriness in the center, and this can go on for decades. Macular degeneration is extremely common. It's around 15 million Americans have age-related macular degeneration.
So what procedures do you perform then in your clinic here, or in your office, or at the hospital? I'm not sure where you perform your surgery.
Sure. So there are a lot. We do procedures both in the office and in an operating room. Macular degeneration, the current treatment for the wet form of that is injections of medication into your eye.
It just sounds painful.
It does. It sounds really crazy, doesn't it? Everybody was taught not to poke a needle in your eye, but that's the current treatment, and man, it's so effective. Before these medications were approved, which was about the year 2006, there was very limited treatment for wet macular degeneration. In fact, when I was a resident, if patients developed this, you would tell them, there's not much we can do. We can laser this, and that alone will cause loss of vision, but it might stop it from getting worse. But that's about it. You can look forward to very poor central vision for the rest of your life.
So you've explained to us what you do, so I'm interested, you're in the medical field, so what's it like being in the medical field and running a small business?
Well, it's a challenge for sure. You know, you get out of medical school and you think that you're going to practice medicine and that's all you have to worry about.
Right.
My goodness, that's the farthest thing from the truth.
They need a couple classes on running a business at medical school, right?
They need any classes. Even one would be a tremendous benefit, yeah. Running the business is, without a question, the most challenging part of my job, and I think that would be true for most physicians who are in an ownership position.
Yeah.
There are new challenges with decreased reimbursements, changing laws, regarding healthcare, regarding compliance, regarding privacy. They're complex and they change constantly. So it is very difficult, and you have to keep on top of it to remain profitable. And in medicine, we are at a little bit of a disadvantage from the get-go because we're not trained for that.
Yeah.
It's a lot of learning on the job.
So has the Affordable Care Act impacted you much then in your business?
It's kind of early to tell. We all whine about it, you know.
Yeah.
But I think we whine because of change and uncertainty.
Sure.
So
All right. Well, Dr. Goff, we appreciate you being on our show today. Thank you very much.
it's been my pleasure.
All right.